keep really the towel technique as good as you can. Yeah. So I will just start. With the technique of draping. Yeah. So we are going to. I'm going to show you some technique on the abdomen. Who do you think would benefit from that?
Someone with IBS.
Yeah. Irritable bowel syndrome.
Digestive problem.
Digestion problem.
Constipation.
Constipation. Yeah. Cramps. Maybe around maybe the period where there might be some aches and pains. And just general relaxation. Not very common, I know, but some people really love it and they will come especially for that. So instead of thinking about it like, ooh, when am I going to do it? Think about it as another tool in your toolbox, another technique that you can do if someone asks you. And it's nice to practice it once in a while. So I would not say that you will have this technique done in every day or week when you're massaging, but once in a while you will have it. And it's nice to be comfortable with. Starting with the client position now. Supine, regular, put a lot of pillows under the belly, because when they lift, there is a lot of pillow, the stomach would be more relaxed. Yeah?
So under the knee. Under the
knees. Underneath the knees, yes, in here.
Okay.
This position, underneath the knee. By the way, sometimes what I see is student putting the pillow this way. Is not the same, completely not the same. What happened here that you are actually stressing the knees. You will really have to do it where the ankles, the heel bones touching, and that's where it relaxes. It's also very good for lower back. Okay, so before actually starting massaging, you can have a whole approach of doing abdominal without undraping. You can do a whole technique once you're there. So it can be starting with a hold. You can do that on the rib cage itself. So really feel my hands like floating, supporting and floating and listening. You can do the same thing on the abdomen, either on the side. So there is no science to it, it's mostly art. When you feel comfortable, and your ability to just being, not do. Take the time. Something that so precious. Your clients wants to learn how is just being could be good enough. I don't need to do much. Nice sounds. When you have sounds of the digestive system, it always means the digestive system more active. Is it good sign or bad?
Good.
It's good because what nervous system would enhance the digestive system? Parasympathetic, so it means that they're getting relaxed. So it sounds good. And you should associate it to your client with a benefit of the massage. Otherwise, they can feel quite shy or uncomfortable about, the sound that my abdominal digestive system is doing. Okay. Generally, I would say that I will have two approaches for working on the digestive system. One is direct on the abdomen, and the other one is on the skeletal frame around it, on the bones around the digestive system. And what I'm talking mostly about the lower ribs and the hip. imagine that this is the picture and you have frame of bones around. So, and these abdominal organs adhere in some ways through, believe it or not, fascia into the frame of the skeleton. Otherwise, they will all fall. So the liver, the spleen, the stomach, the large intestine, the small intestine, they all adhere into the spine, ribs, hip. And one way to mobilize them is actually working on and mobilizing the skeleton, the ribs, the hip. Twist, like a figure of 8, but very slow. So my lower hand is on the hip, my upper hand is on the lower ribs, and that could be really a nice slow technique that you can do. You're changing.
That's really good.
Yeah?
Mm.
You can do same side and release. So this would be like really slow rocking. And wait, and then release it. So I use a lot of my body weight. Good. You can take a different approach, and now using your 2 hands on the ribs. That always remind me of lizards or, apes, that you need to have this movement. We're very much extremity oriented and not enough body oriented movement of the torso. So a lot of shoulder pain comes from, trying to do this and that and all what we have around us, but we're forgetting that we have this mobility coming from, from evolution, ribs, picking apples, moving this way, stretching that. So coming to move that area. Even, I would dare to say, working on the sternum and the lower ribs. Get the softness, get the moment of what feels good. And don't do too much. It's under your hand really. You can even, if you want to take it a little bit further, you can take the arm there, hold it. Remember our joint mobilization? Now, come and look at this area. Do you see the movement here? I actually now do a bit of traction to that area. So I move the shoulder that way. Do you see the movement also on the ribs? So I give it a nice light stretch. My arms goes that way, and the other arms push it the other way. Or just help it and move it in a lullaby fashion. The breathing is quite key for that inner massage of that. I'll come to talking about the breathing soon. Or even putting it on the hip. And a lot of the art is finding how would it be comfortable for her. You can't inflict it. How would it be? You need to negotiate with the form of each person to find it. Now, it seems like I do more like rib stretch and traction. Well, the abdominal, again, this is our focus, abdominal area. Don't forget it, but yeah, sometimes you need to work on the frame rather than the abdomen itself. Let's talk a little bit about breathing. Yeah? So we have the diaphragm here. Yeah? Going to remember the dome shape of the diaphragm? Yeah? What do we have underneath the diaphragm? So what do we have above the diaphragm? Which organs? Heart and lungs. Okay. What do we have on this area? A bit on the left, stomach. And stomach actually adhere to the diaphragm. So think about the diaphragm moving up and down, and think about the stomach as an organ that actually attached to the lower part of the diaphragm. The diaphragm is really thin. So the stomach attached here. So you're breathing in and out. So what it creates? It creates movement. It creates movement, and it creates an inner massage. That's why part of the digestive system problem of constipation, when people sitting and slouching, can you imagine what it does to the pressure here on the internal organs? Not good. Yeah, it not allow them. It doesn't have enough space to create this movement. So, you can actually enhance it by asking the client to breathe in and breathe out. Yeah. So we've talked about the ribs, how you can move the ribs in any way. Yeah. Either assisted even with the shoulder, yeah, or even take, for example, the other shoulder. Yeah. And move it, and actually one hand underneath the scapula, one hand underneath the more backward of the shoulder of the ribs. Very easy seesaw. One hand, the other one. Then you go on to the abdomen itself, and then on the hip itself. Even hold the hip from the forward and just create a nice twist. The rhythm of the abdomen, here it comes, is quite slow. If you do things quick, I can't do this movement there. Abdomen is like the head, or you have to move it slow. Secondly, here comes the abdomen itself. You need to have quite soft hand. You need to work on the whole of the hands, or really reinforced hand, quite soft. Just find an area of tenderness. There is not much beyond that when you work on that level.
When you say tenderness, how do you find that? Is it the same?
Tenderness is feedback.
Okay.
Forget about you know it. It's actually, who was it? I think we've talked today in the morning about the difference between I know and because I'm a therapist, or I'm a good therapist because I listen to the client. So a lot of the tenderness, a lot of the things are subjective. And I think that the more you feel comfortable about yourself, the more you understand that actually you get to have feedback from the client. So people would say, oh yes, I feel they not here, or it's subjective.
Do you always do it over the towels?
No. Here we comes to do it above the towel, okay? So above the towel, you take the client's hands and ask them to fold it, and then you can come and yes, so the hand is warm. Yeah. And then you just be sure, either you tuck it, yeah, just like that, and that's how much you can expose, and then you're using oil. Yeah. Now, it's like a lot of things in the massage is not what you do, but how you do it. Yeah. So be quite gentle and enjoy it, and just playful with it. Yeah. The first thing you can do is the effleurage. So one nice way is just to do the effleurage in a circle.
What do you do if they've got their stomach unpierced?
Sorry?
If there's a piercing,
They will need to take.
they have to take it out.
Well, otherwise it can bump into it. Yeah.
Isn't there some story about someone slipping
When
their
you
finger
Eh?
through it
circle,
and
do you not have
pulled
to
it off?
follow the same
Yeah, one direction.
direction of the like clockwise, something like that?
When you work deeper, I'll show you why there is a, but effleurage is quite onto the skin. Now remember that actually the stomach does not end here. You can work all the way. And it's quite nice actually to work all the way into the ribs. Because some of the abdominal cavity is still underneath the ribs. So you can do here. I'm almost on quadratus lumbarum. Yeah? And then create like a nice traction from the side. Yeah? I can do the same as I did before. Now you can see it a lot more. Or one hand on the lower ribs and then bring it towards you so you can work a little bit more underneath. That's some technique they call the diaphragm mobilization. Yeah? The diaphragm is somewhere there underneath. You can't really feel it, but you just aim into working there. So I don't put a lot of pressure here because it can be quite tenderish. When I bring it here, I sort of like create a little bit of a dip. Yeah, can you see it? This is stretch, this is a dip. I can go in. It's like having that towel brought to me so I can go more into the fold. Then when it comes to working on the digestive system, this would be the stomach here, but it's quite deep. This would be the small intestine. The large intestine goes into that direction.
Where's the
Yeah?
colon?
So that's the colon.
That's the colon system.
The large intestine is the colon. So when it comes to a bit of a deeper work, you should work, that's the book saying, you should work in the direction of the flow. Yeah? And that clockwise. So you can start from here, then go on to this side, and then it sort of disappeared into the hip, so you leave it where the hip bone on the left side. So starting from the right side,
How much pressure you put in there?
medium. The only one of the pathologies that I would not do that is people with high blood pressure, because in high blood pressure, the aorta there, if I start press on the aorta and the aorta itself has pressure in, potentially it can burst. It's called aneurysm, so we leave it, okay?
You wouldn't massage your stomach at all, or you wouldn't massage?
I would not
pressure?
massage deep,
Deeply.
no deeply. But generally, I would just put a little bit of pressure, ask them where do they feel the tenderness, but a lot of it is actually movement and relaxation. So if I find a tender point, I will just stay there and then slowly release it. Yeah. I would work a lot on the ribs, a lot around to give this sensation of 360 degrees of body. Yeah. Yeah. Quite slow, repetitive. Yeah. I think you have quite a lot to try to do first. The position with towel and then without.
Yes. Maybe slower, but the same.
So
Yeah, stop there.